So my name is Kwok Pang. I'm one of the co-founders of Autonomous. Autonomous is a software provider to the cell and gene therapy space. Our specialty is manufacturing software, but we're also looking at how we can support the entire value chain from end to end. And so I guess we'll start with our introductions from our panelists. And we've got a variety of different perspectives looking at digitization in Industry 4.0. We've got hardware suppliers, software, service providers, organizations supporting innovation, and also talent. How do we bring talent into our industry? So let's work our way down for a quick introduction.
Hi, I'm Nick Stevens. I own and run RSA, which is a 41-year-old executive search company in life sciences. As such, I hope to be able to bring you a global helicopter view of what's going on. If you want specifics, I think the rest of the panel may be better suited to do that. I also sit on the board of two biotechs, an agri-tech, an IT company specializing in healthcare, and also more recently Royal Mail Medical, which is, I think, going to make an interesting space in the healthcare system in the UK.
Hi, my name's Verity Nancollis. I work for Pharmaron. So many of you may or may not have heard of Pharmaron. So we are better known for chemical manufacture and radio-labelled chemicals. However, our Liverpool site is actually a CDMO focusing on the development and manufacture of gene therapy products, viral vectors and plasmids, so mainly focusing on AAVs and plasmids. But it's a lovely site, around 220 people on site. My role heavily revolves around the planning, resourcing, scheduling of all our activities on site, but I've also been heavily involved in defining and driving our digitalisation strategy. My background is all technical, downstream process development and manufacturing. So that's my disclaimer. I am not I'm not an IT expert. I am not a software expert, but what I do come with is experience of trying to drive digitalisation on a rapidly changing site.
Hi, I'm Gaurav. I'm the co-founder and CEO of Trisk Bio, a relatively new startup. We're building a fully automated CDMO for sort of general biologics manufacturing. We use robots to manufacture in many small batches, completely parallelized, so you can sort of stay at process dev scale and then move into the clinic and even post-approval with just many parallelized small bioreactors, so you eliminate the issues of scale up. Pretty much everything we do is based on digitalization and what digitalization enables.
I'm Antoine, CEO and co-founder of Microfluidex. We're developing a piece of bioprocessing hardware that we call the Cyto engine. It combines very precise and scalable bioprocessing in microfluidics, online sensors, and data visualization and data mining. What this does is enables users in the cell therapy space to go from a cell culture at a very early stage, discovery stage, to manufacturing stages at a very low cost.
Hi everyone, I'm Andreea Iftimia-Mander. I'm here representing Biomatics, for which I'm the Director of Life Sciences. We are a management consultancy with a strong focus on digitalization and automation, and we've worked so far with several clients to help them with their needs around digitalization and automation. We've learned a lot in the process, and I think we're trying to spread the knowledge and what we've learned so far by working with these clients and hoping to support the sector and progress some of these ideas that are coming through the new strategy for Industry 4.0.
Great. So let's maybe start from a macro level. So why do we need to digitize in the cell and gene therapy industry? Would you like to share your view on why do we need to digitalize?
Yeah, I think it's going to be a little bit controversial. It's part of the reason I chose what I'm wearing today, because I look quite a lot like Healthcare 1.0, right? And Healthcare 2.0 had this amazing invention called medical records paper. And Healthcare 4.0 is intrinsically no different. We are managing data and transmitting data and helping to make that data actionable for the benefit of people. And while all of these tools enable us to do that faster, more accurately, in a more personal and a more predictable way to drive outcomes, we have to focus, I think, not on the tool, but on the patient. That's really going to be the core of my message through this, is if what you are doing with automation, with digitalisation, with cell and gene therapy isn't focused on the patient, then it will not add value. So the tool is not the outcome here. The tool is something that enables you to drive better outcomes for patients. And in cell and gene therapy, I think especially in autologous cell and gene therapy, this is a critically important set of data tools, because by definition, if you make one mistake in a batch of autologous medicines, you've made two mistakes. You've either denied two people treatment or you've harmed two people. So if you're thinking about autologous therapies, it's essential you think through your data strategy before you create your product or your process. Without that data strategy in place, you will have to re-engineer something, or you will fail. And if you fail, you'll harm people.
I mean, from a CDMO's point of view, obviously we strive to do the very best we can for our customers and their patients. So again, digitalisation, it's not necessarily the fact that we are digital that's the benefit. It's if we can bring better quality products, better quality processes to our customers, to patients, quicker, you know, obviously, why would we not?
Absolutely.
Yeah, and I would actually just echo what both previous panelists said. I think you almost should be wary of digitalizing and certainly automating, because there is a trade-off between flexibility and sort of reliability and repeatability, right? So one of the reasons why R&D, life sciences, has resisted automation, despite sort of waves of roboticists coming in and glancing at what happens on the process dev bench and saying, oh, I can automate this, is because actually if you automate 95% of it, you've done almost nothing, because you still need the operator there to do the 5%. You can't actually get to an outcome. In manufacturing, where reliability is critical and you actually want no variance, it's a place where automation can make a big difference, because you want to be on one extreme of this kind of variability, reliability trade-off. But even then, you want to make sure that you're really automating things that are the most important for patient safety and the most onerous for your operators. There's a lot of fancy things about kind of automated freezers that come up and hand you a vial, and you think, well, how many operators does it take to put a vial through an airlock? Not that many. Anyway.
So why is it important? We see cell therapies, from the cell therapies point of view, what we see is very long development cycles, right? A very long discovery, preclinical and clinical processes. A lot of them are delayed due to manufacturing issues. And then when they come up in the commercial stages, they are very expensive. And so thinking about why these development cycles are long and why those therapies are very expensive, at the heart of it, we think, is the lack of control over the process and over the cells. You have scientists in the lab working with, flasks, multi-well plates. They're not actually measuring a lot, right? They're running their experiment, and then at the end only, they will take the cells and do some analysis. How's the process gone? What has been the shear stress on the cells? What will be the viability of the cells across the, during the process? We don't know that. And then at manufacturing scales, so then there is a scale-up need for phase 1, phase 2, phase 3, and now you have to tinker with very large vessels, where still the process is poorly understood because there is very little analytics put on those bioreactors, and so now you're tinkering with very large volumes, very large amounts of cells. It becomes very expensive, and you're still exploring a very small portion of your process space. And therefore, when you move to manufacturing, it's both you get batch failure rates, which we've seen up to 20% for some of those clients, and you still don't know what's going on really with your process. So digitalization is enabling this, the data is going to inform on how your process has gone, how your cells have gone in correlation with that process, and that guarantees that treatments can move from early stage research to cheap manufacturing quicker.
Yeah, I think Antoine makes a a really good point, and that's sort of our experience in working with our clients. So digitalization came into play at a point where they were growing or scaling up, and it all of a sudden becomes a real necessity. And I think we were quite privileged in a way to be involved in the delivery of the Lighthouse's labs, for example, for COVID testing. And I think there's some crucial lessons that were learned there, because we had no choice, right? We needed high throughput, lots of testing. So there were some lessons that had to be learned there very quickly. And we were, like I said, privileged and fortunate enough to be part of that journey and learn those lessons alongside the organizations that we worked with to implement those. But I think, you know, we can now apply some of those lessons. There's no need in reinventing the wheel, I don't think. So digitalization is important, as Antoine said, into, you know, when you're scaling up, when you're growing, when you need to reduce the cost of manufacturing in order to get more consistency in your product and so on. So yeah, I think digitalization is the way forward, but we need to have better equipment that we can, and we've had these conversations about, you know, how do we harvest that data? What do we do with that data? What does the data tell us? You know, we need better solutions for how we process, analyze the data, and how do we use that information to optimize processes and so on.
Absolutely. I think we need a very strong why, because you can't digitize just for the sake of digitizing. In Industry 4.0 is like a buzzword, right? We all want to be doing that. But you need to know why are you doing that, and especially all the points mentioned, like showing that you have control of your process. Cell therapy is so different to biologics manufacturing. Autologous, we're talking about one batch per patient. If we are to get to the numbers of patients that we want to treat as an industry, we need to multiple X's the process intensification that we are currently doing, drive down the cost of goods, but then by increasing your intensity of manufacturing, you then increase the risk. And so if you're still relying on procedural controls, paper batch records, you're not going to be able to show compliance, and therefore you're going to be blocked from scaling up. And so the why is super important. Now let's kind of move on to what are the barriers for implementing digitization? We can do it in any order we like. We don't.
Do you want me to jump in?
Yeah.
Okay. So from a CDMO's point of view, it is challenging, you know, to I guess fit digitalization innovation in around, you know, your day-to-day operations. Obviously, we're delivering for clients. You know, we really want to do the best for our clients. So whatever we are doing in terms of digitalization, in terms of that work, we need to be doing that with no impact to our client projects. Mm-hmm. And I think one of the key things that we are finding is that you really do need a digitalization strategy that sits well with, it's well thought out, it matches your business direction, your business strategy, the benefits, the whys, what you're trying to achieve is well understood at all levels of the organization, and the buy-in is there. Otherwise, you will struggle. And again, I think it's been reiterated many times. You know, you don't want to just digitalize for the sake of it. You really do need to think about what it is within your organization that you think you can change or improve. You know, don't just pick a system because it looks good. You need to think about the end goal ahead of time.
Yeah, I think it requires, to do it well, you need to understand both like what is sort of automatable and digitizable in a robust way, and that itself is like a big undertaking. Mm-hmm. And then you need to understand like the problem you're trying to solve also in an extreme way. So if you look at like, you know, we automate a lot of hardware at my company, and so we always Google around to see if somebody's already done this, right? And there's always some thermo version that says like automated this. And then you look at it and it's like has automated the absolute easiest part of this that was not a big problem at all. It's like some connection or whatever in your plate prep or something. And so that's like understanding what's easy to automate and doing that without understanding like what the user actually wants, right? Mm-hmm. And then there's understanding what the user wants. But if you only focus on that, what you end up with this kind of Rube Goldberg thing where there's 1,000 checks boxes because like the user might want 1,000 different things. And so those are like kind of detailed examples of what Verity's describing. And you need to find places where you have leverage because there's a way to do something that kind of like robots like to do, like therefore it's actually robust, but that's actually serving as a replacement for what humans like to do. And it can be very difficult. So like one thing that we're dealing with is like for humans, like dealing with plastic tubing and sort of single-use bags and stuff is easy because you throw them away and they're light and all this kind of thing. Robots much prefer stronger things because they don't have any sort of force limitations, and that you get robustness from that. So there's these discrepancies that you have to grapple with if you want to make a difference.
I would frame it around, what do you measure? How do you measure it? What do you do with the data? How do you combine the data, and then how do you exploit the data? So I think there are barriers around all this at all stages in this process. So what do you measure? Having a bioreactor, big stirred tank bioreactor, do you measure? Is it representative measurement if you measure 1 point in the bioreactor or not? Are you measuring just DO and pH, or do you actually need to measure also amino acids and metabolites, etc.? Which metabolites? So there's first a question around how precise is your bioprocessing? Is the measurement that you're taking representative? The second one around how you measure. I think there's a clear lack of technologies for online measurements. There are starting to be some companies that are doing that, but in general, there is a big issues with, if you think about sensor patches, there's a big issue with, calibration, deviation over the course of the process, and that's only, pH and DO. What about all the other things that you want to measure? There's amino acids. There's nothing that does online amino acids at the moment, for example. Then what do you do with the data? Well, first, I think there's a lack of standardization around making sure that all the instruments are pulling all the data in one central location. Right now, people are measuring things and then writing on a piece of paper. There's no, or data management workflows that are really horrible, with people having to copy paste things in Excel and then combining Excels, and then it's very manual. And then at the end, what do you do with the data? It's a very specific skill set. It's very hard to find people that have skilled in biology and bioprocessing and data. So that's Andrea's space. And so there's a clear lack of skills because people are doing the cell culture don't necessarily have the training to then manage a vast amount of data.
Yeah, so absolutely. A big blocker, I think, in digitalization is having that in-depth knowledge and understanding of your process and understanding exactly what needs to be digitalized, because as Verity said, there's no point in digitalizing for the sake of digitalizing. It's not a tick box exercise. You need to digitalize something that will add value, will save you time, will save you money, and that requires a really in-depth knowledge of your process. So what bit of it, if you automate or digitalize it, will actually add value? And sometimes people struggle to get that sort of information and data because you have all these various equipments that don't really talk to each other. So you have to extract data and information from various bits and then try and piece together that puzzle and that picture and understand your process and understand where your KPIs are and how to optimize it. So I think sometimes that can be a big blocker to digitalization, not being able to fully understand the whole picture. And also funding as well. I think, it's not cheap to digitalize. And also not all clients or not all organizations are in a spot where they maybe have made a big investment in something and now they kind of have to roll with what they have and make the best of what they have. So not everybody's in a more privileged position where they can start from scratch and think about the digitalization strategy and so on. So, it requires a fairly large investment in capital, I think, and funding.
Yeah, I think that's a really interesting point. So, yeah, we need the funding, and that goes back to the why. So if the why is strong enough and the pain is strong enough, then that justifies the investment into trying to resolve that issue, right? We talked about just now the risk of all these manual operations in how we currently manufacture cell therapies. It's an array of unit operations with multiple devices. And so how are we going to be able to roll that out if it takes a whole set of pieces of kit and highly trained staff to be able to do the analysis or manufacturing? So we really need to be looking at and thinking about how can we simplify the process, how can we take out a lot of the manual interventions. So when we've been building out our platform, we've been building an array of integrations to all of the kind of key area touch points. So to LIMS systems, quality management systems, analytical kit, manufacturing kit, just to really try to take out all of those manual interventions, risk. And if there's risk, that means you need to check. If you check, then it's more time. If it's more time, it's more money. So it all links together.
I think so. I might redefine my definition of you've got to do this at the start. Thinking on it. So, one of these things is Albert Einstein said, didn't he? If we knew what we were doing, we wouldn't have called it research. So there's this fundamental piece in the life sciences where you start with a biological insight and you go from an insight to an action, which is almost like art. There's one person who understands what they're doing and thinks they're doing what they're doing, and especially I think in cell and gene therapy, you see this a lot. There are 5 gods of gene therapy, and they all started on their own tinkering with stuff, and they worked out how to do some things, and that certainly wasn't a process, and it certainly could not have been digitized at the start. We would have made no advances. In fact, you almost need the errors at the beginning of this process to make the discoveries and to create something useful. And then there's a transition from art to craft, and this is where the person who made that discovery teaches some people around them how to do the same thing, and they all do pretty much the same thing in pretty much the same lab, but with some variation. And every now and then you get a real advance. Sometimes that's a log scale advance in output or whatever, and it's especially true in fermentation technology type stuff. And then you have to go back and look at what you did and turn that into a reproducible process. And that's where you take a craft to a technology. And this has been true in every industry ever, which is that people create things as individuals, they teach them to other people, and then somebody learns how to do it at scale. And that's where the cost savings come in. So I think I'm going to redefine beginning to somewhere in that craft to technology journey. And that's where digitalisation becomes not only useful but essential, because if you don't have it, somebody will outcompete you. Look at Elon Musk and Tesla. So somebody will outcompete you if you don't. And if you don't define it properly in the life sciences, you'll not be allowed to put it into patients anyway. So the regulation and the drive for efficiency marry together to demand digitization, I think.
But I think the fact that you mentioned the art going into the craft, we have to acknowledge that will be going on all of the time. That's never going to stop. So the investment that we're putting into the technologies, as you referred to it, the investment that we're putting in now, that we're spending now, we need to be sure that they're robust and flexible enough in an ideal world to support the next art, the next craft. We don't want to spend all of our money on a system that's only going to last us 2 years. We know how quickly this industry changes, and we would really like digital platforms that are going to support us for many, many years to come.
Yeah, no, that's a great point. Flexibility and agility, right? Because one thing for certain, change, right? We're moving so quickly in our industry in all areas. The hardware that we use to manufacture, the process that we're following. And so what we need is actually flexible tools that can follow that change and enable the stakeholders to be ready to react to change, right? Rather than trying to work out what that is we're trying to do, right? We need to be prepared for change.
And I think that's one of the challenges that was discussed this morning in one of the previous sessions around the PAT is a real challenge, the speed at which things are changing, the speed at which technologies are developing.
Yeah.
It's a consistent challenge, it's not a new challenge, it's something we've always faced in this industry.
Especially with cell therapies where we're starting with patient material. So each patient's going to react differently.
Completely.
So
yeah.
we need PATs to be able to tell us, actually, it's not time point 3 on every patient. It's going to be 2 point something, 5, depends on the patient. And so we need better ways to gain insights of what's going on in this particular patient. Now, keep in mind, where we want to be in a couple of years, hopefully, is hundreds, if not thousands, of parallel runs. So we need to know exactly what's going on for each patient's product in a given room. And then we can talk about decentralized manufacturing in a while, I'm sure. And that adds another X to the complexity of what we're trying to do.
Yeah, in terms of like the investment needed to digitalize, I think it's tends to be less of an investment issue. I mean, aside from like the organizational dynamics associated with investing in a certain area, and it tends to be talent constrained. So there's a question of like how you get people who are really, really good, particularly on the software side, to come and work with you. And what I have found is that the bioprocessing industry is definitely under-marketed to high-end software talent. And it's kind of interesting why this is the case. There are a lot of really good software engineers who, in their early 30s, mid 30s, have a little bit of like an existential crisis. Why am I working at Google? What can I do? They want to work in biology, and the natural place that they get sort of heat sunk into is like on the R&D side. And as I discussed earlier, it's interesting because that's actually the place where automation is not that valuable, at least relative to manufacturing, where like you really want robust systems, right? And so there's almost like this, just this knowledge gap where you actually have this exodus of extremely talented programmers who are looking for to like meaningfully make a difference, often in biology specifically. There's a lot of excitement around biology. But they very rarely fall into looking at bioprocessing. Instead, they tend to fall into looking into R&D and like limb systems, and that's why there's like a cajillion different ways to pipette 96-well plates, is because every time a group of people get involved, they do this. And I think that's like a really big opportunity for the industry, because I think the value that software engineers can create in the industry is massive.
Can I jump in just for
Yeah,
a second?
yeah.
I also think, we don't work at that low level, but I think there's a fundamental difference between the life sciences and the consequences we've already talked about, and the general software industry. So software industry generally throws out something that's nearly good enough and lets the end user beta test it, lets the end user identify the bugs. If you do that in life sciences, that's not going to work. So you're somehow constraining the creativity of a great software engineer for very good reasons, but it makes it tough for them. It's a bit like the PhD who goes into a gene therapy company and spends their life pipetting stuff. Why have I studied 6 years to do something I could teach a 7-year-old to do?
I think that depends a lot on the maturity of the software engineers. There are certainly industries like high-frequency trading, some of the more like mission-critical areas of Google, even machine learning, where modern software practices are actually relatively similar to what you would want when you're developing like critical software. All the changes are logged, there's change reviews. So mature software engineering has actually become an engineering discipline. There is this sort of edge case where you can code up something in like very fast that kind of provides value, like this kind of like early Facebook days vibe. But that was more true, I think, in like the sort of late 90s through the 2000s than it is now. I think software engineering has actually matured into a field where it's like a real engineering field.
I completely agree, because our company is founded between 2 different industries. So myself and Professor Mark Liddell come from the industry, and then our CEO, Alexander Saif, and our CTO, Alexi Blaine, come from the telecoms industry. So they bring the software know-how and the enterprise level technologies to the mix. And so that's how we've managed to really accelerate the way that we've built our platform and have it scalable as our customers' needs grow as well.
And for us as a CDMO, it's really good to see that there are now software companies specifically focusing towards this area. Historically, what we have found is that we'll engage, with software companies. Software companies are great. They will engage with us. They will come in, discuss what we're doing. But more often than not, what we find is that yes, they support the pharma industry, but when they get to the nitty-gritty of a biologics process, they are shocked at the complexity, and they don't necessarily have so much experience of, applying that software to a huge number of biologics gene therapy companies. So it's a challenge that we face. But like I say, we engage heavily with the vendors. We bring them on site. We talk them through our processes, help them understand.
Yeah.
But I guess that's maybe a vendor engagement that we didn't necessarily anticipate. It's all time and resources, isn't it, to go through those activities.
Yeah, absolutely. I think in the other panel where the CDMOs were talking, they were talking about how do you build trust between yourselves and the clients, but it's also between yourselves and your suppliers, right,
course, yeah.
of solutions. But it also can be an opportunity for the CDMO in the sense of differentiating yourselves from other CDMOs within the space. As we evolve and as technology is going to be applied to the manufacturing side, I guess the demands on your services and the way you deliver your outputs is going to change as well, right? People are going to start wanting their outputs in a digital format,
Of course,
as
yeah.
opposed to PDF BMRs of 1,000 pages, right?
Yeah, definitely.
Yeah. Okay, so now we're moving on to let's talk about centralized and decentralized manufacturing and how digitalization may support that. Any thoughts from the panel?
Well, I do decentralized. We're building decentralized manufacturing. It's not clear how you do it without digitization. So if you want decentralized manufacturing, you want it to be robotic, certainly. So you need extremely robust control systems. That's all software. You need electronic batch records. Obviously, that's all software. And you likely want to remove operator burden wherever you can, because that's going to be a big source of variability. And to do that, you need robots, and to build robots, you need software.
I think decentralized manufacturing is really the future for ATMPs, because it's not always possible to bring the patient to where the therapy is. Also, we're moving more and more towards a global outlook. You have all companies, they are developing products like they have a global outlook. They're looking at the global markets. And it's not feasible to produce your product in one country and have to ship it around the world. So I think, also it's not that sustainable from a climate point of view. So I think decentralized manufacturing is really the future for ATMPs. Yeah.
So I've written a bit about this in a more general pharmaceutical space. I think it depends on what you're trying to do. The pandemic taught us a lot about global supply chains in general. And there is a mistake, I think, made by the life sciences industry that it tries to apply Six Sigma principles to its manufacturing. When you have a gross margin in the 90+%, the cost of failing to supply once is much greater than the saving of getting to that Six Sigma space. So that's part one. So I think we need to focus much more on localizing manufacture. And if you take that to its extreme, near patient is therefore good. And if we're talking again about individual personalized or autologous therapeutics, then the closer to the patient, the better. In fact, if you can do it in the patient, even more so. So I agree. I also think there are going to be a plethora of new tools coming down the line that will displace the tools and the interventions we have now. We saw 170 million raised today for a CRISPR 4.0 approach, something I hadn't heard of until 2 weeks ago. These things are coming faster and faster and faster, and we will always have to take the precaution of doing those in a careful, centralized way before we do them very close to patients by less well-trained people. I think there's a question about the integration of the industry into the healthcare system there. The closer you get to the patient, the closer the industry has to be to the physician, to being like the physician, to being a tool of the physician, not a vendor to the physician. And so that carries new responsibilities with it, the closer you get to the patient. And I also think if you need to respond to something like a global pandemic, then you have to centralize. You can't do this stuff at scale quickly when you're responding to an unexpected occurrence, a new disease, a new pandemic. You simply have to make big things do things fast. You know, Pfizer did it with penicillin in the Second World War. There are 4 or 5 companies who managed to do it with vaccines for coronavirus, and I'm very grateful they did. So my thesis is nearer patient better, fewer chances for problems, whether they be temperature control, batch control, quality control, but horses for courses.
And I think we're quite lucky in the UK, actually, through the advanced therapy treatment centres, for example, that were funded through Innovate UK. And I know this from my previous life, but I think the UK has looked quite a lot at this decentralized model for manufacturing, and how do you bring that closer to the clinic, and how do you best work with clinicians and to deliver that faster and safer and to the patient. So I think from that point of view, the UK has a real advantage compared to other countries in looking at the decentralized model of manufacturing and really looking how to best deliver it through the advanced therapy treatment centers.
Yeah, absolutely. I guess 2 other points that I would say in terms of what comes with decentralized manufacturing is additional risk. So instead of now trying to show that you have one site that is compliant and you have control and you know what's going on, now you may potentially have hundreds of locations that you're manufacturing in. And one of the key requirements that we have to show as an industry is that we have visibility of what's going on at each of those locations real time, and also comparability of those different locations. And so both the MHRA and the FDA have both released guidance or had consultations around distributed manufacturing or point of care manufacturing, and some of the points that are made there is very much about comparability of your locations. So another reason why we need to simplify the process that we're doing for each patient, so then when we distribute that to 100 locations, we don't get swamped with data and swamped with compliance requirements, right? So I think that's an interesting piece. And Andreea was mentioning the advanced therapy treatment centers. I think that's an excellent exemplar of how we might be able to start not all the way to the patient immediately, but at centers of excellence and prove out the processes and the technology that we can use to show comparability on just a few sites, let alone hundreds. And so Autonomous has collaborated with the Advanced Therapy Treatment Centre through the MWATCC, so Midlands and Wales Advanced Therapy Treatment Centre, on a collaborative project to show the value of seamlessly integrating what happens in the clinic, so the collection of patient material, that movement into manufacturing, and how we can, first of all, audit what's going on, because at the moment it's very manual how these scheduling occur, and it's all off system, as in phone calls, emails, and all the rest. So if you have them all on one single platform, you'll be able to show more control. You know exactly where each of these patient products going into manufacturing is, and at what stage that they're at. And so that's, again, giving reassurance as we scale up these operations, right?
Yeah, I think if you want reliability across sites, I mean, I would say this, but I think you need robots. But you don't need, but across sites, you don't need only robots. What you really need is robust maintenance, local maintenance around robots. And that's another thing that's like, it comes back to this talent issue, is that, so you need excellent people to build the robots, and then you also need excellent people to monitor and maintain. And this is a different, easier job than being an operator. But it also is like something really serious that you have to think about when you think about distributed manufacturing for real, is that, like, you know, robots are not 100% reliable and there will be issues. And so you really need robust local maintenance It's not just like you get a magic box and then you're done.
You have to be you have to be I think a bit realistic indeed with decentralization and how far you take it. There will always be a need for a pool of talent around maintenance, a pool of talent. There needs to be mutualization. If you think about QC, the very expensive machines, you're not going to have one per site. Thousands or hundreds of these machines across the UK, right? So it's still going to become. I still see this as maybe not one center for the UK because that creates logistical challenges, but I also don't see it as I don't think the bedside, for example, is necessarily, it's a nice thing to tend to, but I don't necessarily see that happening just because you need, you're gonna need maintenance, you're gonna need QC, so I think those regional center level, I think is a good scale. And that allows you to, pull the data in one central, maybe you can pull the data in one central location, have all the experts that actually are data experts and bioprocessing experts in one central location, and have people who have maybe different skills or, in those decentralized locations, but you're not going to open a manufacturing center in the middle of nowhere. Nobody's going to want to live there. Nobody's going to be able to come and repair it. So I don't want to take decentralization too far as well.
About local maintenance, I was going to say that does it really need to be local? I mean, we've been having some really interesting conversations with people who are developing virtual reality tools, for example, which really play really well into this whole distributed manufacturing, because you could literally use the virtual reality headset, create that sort of virtual space where you can have those conversations, or you can troubleshoot from here into another country. So I think, again, for sort of managing those decentralized model, you'll still have to have a core expert team, like you said, in one center, and maybe just troubleshoot by using a virtual reality sort of environment. That's how I see the future of this.
Yeah, I think that would be, hopefully that will eventually happen. I think
it's starting. I mean, yeah.
The real world has, like, especially when you do mechanical engineering, the amount of fractal complexity that goes on is like enormous, and you really want to be able to touch the thing. Certainly for things that are extremely valuable, where you want to be very precise. I think the trade-off of just having somebody local and the reliability you get for diagnosing problems and solving them, for now, it definitely beats VR. But I think, it could be exciting in the future.
We've seen some exciting things, and I know the cell and gene therapy Catapult, for example, developed a really interesting training model on virtual reality. So I think it's really exciting what can be done with tools like that.
I had QC mentioned just now, and that kind of reminds me of another challenge, decentralized model, which is how we quantify how good our product is. At the moment, we are reliant on flow cytometry a lot, and that is very operator dependent, and you need experience to be able to tell the difference between a patient sample and a normal healthy sample, right? They look very different. And so there are people innovating in this space, looking at potentially automating that flow process using algorithms. So that might negate we need more talent and there isn't enough, right? But there's also digitization will help us as an industry learn faster, accelerate our learning in terms of what is our process doing. And so if we understand our process better, we might be able to identify critical quality attributes that we can measure in line, or PAT, as people were talking about in the other session. And so could we move away from this complex manual way of assessing how good our cells are?
In the nearer term, I think hybrid approaches work well. So, for example, if you're talking about flow cytometry and you have an automated gating of your graph, maybe an algorithm can do that, and then a person can just say, yes, that looks good. That takes a lot less time than actually putting the gates yourself, for example. So I think in the meantime, trusting the software in full is going to be a process for acceptance, and you make it work in general, and then for people to accept it. So I think already moving to hybrid approach where people just have to click instead of having to actually do the thing could be valuable.
I think there's an interesting question here, though, about, we're back to that craft question. Example, Google Health, we saw some work that they did, and I think it was published in Lancet or BMJ, where their optical recognition systems could spot cancerous tissue in X-rays 99.7% of the time, and the average for a fully trained radiologist is 92. So that says, yes, technology is a solution. But then you have to ask yourself, how did you train the software? And they trained the software by getting expert humans to put in their opinions, and then showed the machine thousands and thousands and thousands of those examples. And so the machine is as good as the best of all of those people, the best of the time. If you give all of this work to a machine, where are the humans to train the next generation? Because AI is not self-training yet. It can be self-training in a rules-based system. It can beat anybody at the game of Go. But can it tell you whether you have a cell that is likely to be precancerous or not? Only if a human's told them before. So we still have to have, it's back to your technician thing almost, you still have to have people hands-on, minds on the problem, who have enough training and time to become expert in order to create expert systems. That may go away one day, but that's a long way away now, I think, in biology. Is that fair?
Yeah, no, I think it's a valid point. I think we're quite far away from AI. It's still very much, machine learning. So we have to teach the machines, as you say, to kind of recognize and provide solutions or help with reducing the time for analyzing things. But yeah, I think we're quite far away from self-sentient AI. Yeah.
Yeah, I think you're just kind of discussing critical quality attributes. I think one of the big lessons from machine learning from the past 5-ish years, humbling lesson has been that data has been primary over algorithms when you're trying to do predictive, just predictive algorithms. But the capacity for ML to be interpretable is increasing. And so it's an interesting question to ask whether you can understand what aspects of your bioprocess influence your critical quality attributes by first training a relatively black box model to keep the critical quality attributes tight, and then doing interpretability of that model in order to map the algorithmic parameters, which are effectively meaningless in most of the models that you would want to train, into actual biological parameters. And I think we're actually not that far from being able to do that if there is sufficient data production.
I want to be maybe a bit less inspirational, but I think there's a huge low-hanging fruit right now, which is moving away from paper, right? That's
Excel spreadsheets.
Right, move away from paper, moving away from multiple Excel spreadsheet, and presenting the data to the user in a digestible way. I think that's let's focus on that for the next 5 years, and we'll already made a huge amount of progress. And I would then we can put machine learning on top, and but yeah, I mean at the moment people are still writing things on paper. I mean we're so far away from
paper-based lab books.
Yeah, adaptive. I mean we strive to have adaptive processes, right? But the first step is put the data together, make it digestible, have the user interact with the data at different points, more of an hybrid approach, and then slowly we can have self-driving cars, self-driving processes.
Yeah.
The next generation of machines, again, I think so far everybody's been they've been closing their systems. So, they haven't been very flexible of communicating with all the other systems. So I think going forward, in order to help the whole digitalization piece, the manufacturers of various pieces of kit utilized in the industry will have to make them a lot more flexible, a lot more open, in order to be you know, it should almost be like upgrading your Windows. You shouldn't have to buy a new machine. I know that might not be very good for their business model because they might not sell as much kit, but if we want to really digitalize and not having to, like you said, invest every 2-3 years when a new machine is out on the market, they need to kind of open the systems up and make them more flexible and more upgradable without having to upgrade the whole machine itself.
Absolutely. Well, sadly, that's all we have time for, but that was a great point to finish on. I think it's about collaborating with each other, leveraging each other's learning, and so we can kind of move forwards together. So with that, thank you all for joining the panel, and thank you guys for participating in this.